My name is Dr. Donna Powell, and I am a gastroenterologist with HealthPoint Medical Group. I am the only female gastroenterologist in the Tampa Bay area currently in private practice. I tend to listen a little bit more to my patients and take the time that the patient may need to really make them feel comfortable and like they had all of their needs met during our visit. Typically, colonoscopies are performed for colorectal cancer screening. By meaning screening, colonoscopy is the best way to detect and prevent colorectal cancer. Typically, this starts at the age of 45 in African Americans and 50 in all other races. The age may be earlier in patients that have a family history of colorectal cancer or special hereditary conditions that allow them to have it done earlier. There was an article published in the New England Journal of Medicine regarding the National Polyp Study. This study was a study that was conducted over 16 years, and in the gastroenterology community, the study was huge because it showed that we are indeed decreasing the incidence of colorectal cancer and decreasing the risk of death from colorectal cancer by 53%. So as you can see, getting your colonoscopy done is very important. In order to prep for the procedure, it involves a good cleaning out. And when I say cleaning out, the day before the procedure, the patient's typically on a clear liquid diet, starting early in the AM. They only are able to ingest Jell-O, chicken broth, and anything that they can see through, such as Gatorade or Crystal Light and water. In the afternoon, the day before the procedure, they're given a liquid laxative as well as maybe a couple of pills to help them get cleaned out appropriately in order to prepare for the test the next morning. We also have them not eat or drink anything after midnight the night before the procedure. Obviously, no one looks forward to drinking a bunch of fluid that may not taste very well and involves them having to make several trips to the restroom throughout the day and night. However, you have to keep the, your eye on the prize, and that the benefits of colorectal screening definitely outweigh the risk. And one day of drinking this stuff that may not taste so good is definitely worth the reward of knowing that you are preventing yourself from getting colorectal cancer and possibly getting a 10-year interval before you'll need to do it again. Some of the possible outcomes that may occur when you have your colonoscopy done is we may do the colonoscopy and find that you have a normal colon. In that instance, you will not need another colonoscopy for 10 years if you have no family history of colorectal cancer, or 5 years if you have a family history of colorectal cancer. If we find polyps in your colon, just depending on how many polyps we find, the size of the polyps, and what type of polyps they are, that'll determine when your next colonoscopy is due. Usually that would be either 1 year, 3 years, or 5 years, depending on the pathology and the number of polyps present at that time. Some other things that we may run into when we do a colonoscopy is we may find that you have hemorrhoids on the inside, or you may have a condition such as diverticulosis, which is very common in people over the age of 50, and it's just small pockets that develop in the colon, which we believe is from a lack of fiber in a typical American diet. By getting your colonoscopy done, we are able to diagnose several conditions, including diverticulosis, hemorrhoids, microscopic colitis, inflammatory bowel disease, and of course detecting and removing polyps, which may lead to colorectal cancer later on down the line. This procedure is available at both St. Joseph's North Hospital and St. Joseph's Main Hospital. St. Joseph's Hospital North and St. Joe's Main Hospital have the latest technology when it comes to getting your colonoscopy done. Our nurses and physician staff are highly trained in the latest techniques regarding colonoscopies and other endoscopic procedures that may prevent or detect colorectal cancer and other gastrointestinal diseases.